I'm presenting my persuasive speech on breast cancer. In my audience, I have Nadia, CJ, Nay, Mars, Chaz, and my recorder, Jazz. Breast cancer is a growing problem among women today. Without performing the monthly breast exams, more women would go longer without knowing their risk for breast cancer. For women going without their monthly exams is scary, just the fact of not knowing. As a woman myself, I perform my own breast exams, as you all should do as well. This evening, I would like to discuss the risk of not doing your breast exams, which could lead up to a chance of you having breast cancer. What is breast cancer? Breast cancer is a cancer that starts in the deep breast tissue. Breast cancer is the most common cause of death among women today. The most common types of breast cancer is the ductal carcinoma, which is a tumor that primarily presents itself in the ducts of the glands, which is in your breast. And the lobular carcinoma is a form of a tumor which primarily affects the lobules of the gland, which is also in your breast as well. According to Arthur Pam Stevens, the ductal carcinoma is present in 85 to 90% of all breast cancer cases, while the lobular carcinoma is only present in 8. What's the breast exam? A breast exam is different methods that is used to detect early stages of breast cancer. According to breast cancer screening, only 18.8% of women do self-breast examinations. 19.1% have clinical breast exams, and then only 3.3% do monthly mammograms. Without monthly exams, women who are already infected with breast cancer start to feel symptoms. The symptoms of breast cancer include skin changes, such as swelling or redness, an increase in size and change in shape, which your breasts start to look deformed, general pain in or around the breast, and then symptoms of breast cancer in more advanced stages like your level 3s and your level 4s. You feel irritated, your breast is irritated or is itchy, changes in the breast color, which is discoloration, changes in touch, which is you feel hardness, tenderness, or your breast is warm. It's either in one or both breasts. And then you start to feel your lumps or masses. In order to resolve these problems of breast cancer, you have your various treatments. However, to treat your breast cancers, your doctor have to determine the stage of breast cancer you're in, whether you're level 1 to level 4. For more advanced stages of breast cancer, you have your surgeries, which is the removal of the breast tissue that's infected with the cancer. You have your chemotherapy, the treatment of disease by the use of chemical substances, which is to cure cancer, not just breast cancer, but other cancers as well. You have your hormonal therapy, which is the use of hormones in your body for medical treatment. And then you have your biologic therapy, which is treatments to stimulate or restore the ability of your immune system. Because once you get sick with any disease or cancer, your immune system is weakened. So we use a biologic therapy to boost your immune system. In order to resolve our problems in treatments, you also have your ways to prevent, which was mentioned before with your breast examination. With the types of examinations, you have your self-breast examination, which is an inspection by a woman of her own breast. You have your clinical breast examinations, which is an examination of the breast performed by a healthcare provider. And you have your mammograms, which is a machine that is used to take images of your breast. Here is a link of a video to show more other ways to prevent breast cancer.
cancer is something we don't really like to talk about, but it's important since 1 in 8 of us will be diagnosed in our lifetime. Here are that every woman should know from author and renowned breast cancer expert, Dr. Susan Love. You might have heard that a glass of wine a day will keep the doctor away, but experts say you should consider putting down that second glass.
There is some data suggesting that women who drink more alcohol have a higher risk of breast cancer. However, we haven't been able to do a random study where we say you drink and you don't, and we'll see how much. So it's hard to know how much of it is lifestyle and how much of it actually is the alcohol.
And Dr. Love says don't get that x-ray unless it's absolutely necessary.
Stay away from unnecessary radiation. So if somebody orders an x-ray, you got to say, how is this going to change my care? And if it's not, don't do it.
If you're thinking about having kids and you're under 35, go for it.
If you have a choice, have your children at a young age before 35, because that will reduce the risk compared to having children later.
There's been a lot of debate about mammograms recently. Dr. Love says if you're under 40, don't get a mammogram unless you weigh the risks.
You really don't want to get them under age 40, because then the radiation risk really is higher. Starting at age 40 to 50, it's a little bit less clear because the risk of the radiation is about equal to the benefits of a mammogram. And the breast tissue tends to be more dense. Just being aware of your body and poking around, and if you feel something, getting it checked out is important.
While we don't exactly know what causes breast cancer, Dr. Love believes that exercise and watching your weight will aid in prevention. But most importantly, just enjoy life to its fullest.
Exercise will reduce breast cancer, actually, and maintaining a healthy weight. Calm down and enjoy life as it goes. Death is not optional, so we really got to get the best out of life at every moment.
That's definitely great advice to live by. Remember that if you do feel something alarming, go to a physician and get a few opinions. Thanks for watching Pop Sugar Living TV. Stay healthy and see you next time.
With the different treatments of breast cancer and ways to prevent it, it's very important and urgent that women, we go and get our breasts checked. That way we know our chances of risk of having breast cancer.